Welcome to the Victory Education Lounge. I'm your host, and today we're exploring a fascinating and often overlooked topic: dental health, the link between insulin resistance and oral hygiene. This is part 96 of our ongoing series on metabolic health. Before we dive in, please take a moment to like this video, subscribe to our channel, and share your thoughts or experiences in the comments below. Your engagement helps us reach more people with this vital information. Have you ever wondered if there's a connection between your dental health and insulin resistance? Today we're pulling back the curtain on a topic that's not often discussed but is vitally important: the link between insulin resistance and oral health. Insulin resistance is a condition where the body's cells become less responsive to insulin, a hormone that helps regulate blood sugar levels. When this happens, your blood sugar can rise, leading to a host of health issues, including problems with your teeth and gums. So, how does insulin resistance affect your oral health? Let's break it down. Firstly, insulin resistance can increase your risk of periodontal disease, also known as gum disease. This is because high blood sugar levels can lead to inflammation in the gums, making them more susceptible to infection. Secondly, high blood sugar levels can also contribute to tooth decay. This happens because sugar in your mouth feeds harmful bacteria, leading to cavities. Thirdly, insulin resistance can cause dry mouth by affecting saliva production. Saliva plays a crucial role in maintaining oral health by washing away food particles and neutralizing acids produced by bacteria in your mouth. Fourthly, insulin resistance can make you more susceptible to oral infections. This is due to the fact that high blood sugar levels can weaken your immune system, making it harder for your body to fight off infections. Lastly, insulin resistance can slow down the healing process of oral tissues. This means that if you have a dental procedure or injury, it might take longer for your mouth to recover. Understanding the connection between insulin resistance and oral health is crucial for both prevention and management of dental issues. If you're dealing with insulin resistance, being aware of its potential impact on your oral health can help you take steps to maintain a healthy mouth. Now that we know there's a link, let's delve deeper into how insulin resistance can affect specific aspects of oral health. Firstly, we'll look at how insulin resistance can increase the risk of gum disease. Insulin resistance, a condition where your body's cells become less responsive to the hormone insulin, can lead to high blood sugar levels. These high sugar levels can create a breeding ground for harmful bacteria in the mouth, leading to gum disease. Gum disease, also known as periodontal disease, is a serious condition that can damage gums and the structures that support your teeth. It begins with inflammation and can progress to more serious problems, such as tooth loss if left untreated. But how does insulin resistance come into play? Well, when your body is unable to use insulin effectively, it can cause inflammation throughout your body, including your gums. This inflammation can make your gums more susceptible to the harmful bacteria that cause gum disease. Additionally, studies have shown that those with insulin resistance often have a higher amount of these harmful bacteria in their mouths, further increasing the risk of gum disease. So, how can you manage this risk? Regular dental checkups are crucial. Your dentist can help detect early signs of gum disease and provide treatment to prevent further damage. An improved oral hygiene routine is also essential. This includes brushing your teeth twice a day, flossing daily, and using an antimicrobial mouthwash. In addition to these oral hygiene practices, managing your blood sugar is key. This might involve lifestyle changes such as adopting a healthier diet and regular physical activity, which are known to improve insulin sensitivity. Let's take an example to illustrate this. Sarah, a 45-year-old woman with insulin resistance, experienced frequent gum bleeding, a common symptom of gum disease. After improving her blood sugar control and adopting a rigorous oral care routine, her gum health improved by 70% within 6 months. This just goes to show that managing your blood sugar can significantly improve your gum health. Remember, every step you take towards better oral hygiene and improved insulin sensitivity is a step towards better overall health. Next, let's examine the relationship between insulin resistance and tooth decay. Insulin resistance, as we've mentioned before, can cause high blood sugar levels. Now, what happens when you mix high sugar levels and your teeth? You get a recipe for tooth decay. Tooth decay is essentially the destruction of your tooth enamel, the hard outer layer of your teeth. It's a problem that can affect anyone at any age, but the good news is, it's largely preventable. One of the key culprits is high blood sugar levels, which provide a feast for the bacteria in your mouth. These bacteria produce acids that attack your tooth enamel, leading to cavities and decay. So, what does insulin resistance have to do with all this? Well, when your body isn't responding effectively to insulin, your blood sugar levels can rise, increasing the risk of tooth decay. But don't fret. There are strategies you can employ to manage this situation. Firstly, consider adopting a low-sugar diet. High sugar intake not only fuels the harmful bacteria in your mouth, but also contributes to insulin resistance. Cutting down on sugary foods and drinks can therefore help to control your blood sugar levels and reduce your risk of tooth decay. Next, uphold a regular brushing and flossing routine. Brushing twice a day and flossing once daily can remove the plaque that harbors these sugar-loving bacteria, protecting your teeth from their acid attacks. Finally, consider the use of sugar-free xylitol products. Xylitol is a sugar alcohol that can actually help to reduce the levels of harmful bacteria in your mouth, further protecting your teeth from decay. Let's consider the case of John, who's 38. He struggled with recurring cavities due to his insulin resistance. By addressing his insulin resistance, adopting a low-sugar diet and maintaining good oral hygiene, he had no new cavities in the following year. So to sum up, cutting down on sugary foods and maintaining good oral hygiene can drastically reduce your risk of cavities. It's a simple, yet effective strategy in managing the impact of insulin resistance on your dental health. Insulin resistance can also affect your saliva production, leading to dry mouth. This is a common but often unrecognized symptom of insulin resistance. Dry mouth or xerostomia is not just uncomfortable. It can also have serious implications for your oral health. Saliva plays a crucial role in maintaining oral hygiene by washing away food particles and neutralizing harmful acids. Reduced saliva production can thus increase the risk of tooth decay and gum disease. So, how can we manage dry mouth related to insulin resistance? Well, there are several strategies you can adopt. First and foremost, make sure you're staying well hydrated. Water is essential for saliva production, so always keep a bottle of water handy and sip throughout the day. Next, consider using sugar-free gum or lozenges. These can stimulate saliva production and help keep your mouth moist. However, be sure to choose products that are sugar-free, as sugar can contribute to tooth decay. For some people, these measures may not be enough. In such cases, it might be worth considering saliva substitutes. These are over-the-counter products that can help moisten the mouth and mimic some of the beneficial effects of saliva. To illustrate the benefits of these strategies, let's look at an example. Meet Lisa, a 52-year-old woman who experienced chronic dry mouth as a result of her insulin resistance. Lisa found that her dry mouth was not only uncomfortable but also led to frequent throat infections. After managing her insulin resistance and adopting these dry mouth strategies, Lisa reported a 60% improvement in her symptoms within 3 months. She experienced fewer throat infections, found it easier to speak and swallow, and overall, felt much more comfortable. To sum up, dry mouth is a common symptom of insulin resistance that can significantly affect oral health. But by staying hydrated, stimulating saliva with sugar-free products, and considering saliva substitutes, you can manage this condition effectively. Remember, each small step contributes to the bigger picture of your oral health and overall well-being. By managing your insulin resistance and staying hydrated, you can improve your comfort and reduce the risk of oral infections. Finally, we'll explore how insulin resistance can increase the risk of oral infections and slow down the healing process of oral tissues. Insulin resistance, by compromising the immune system, paves the way for opportunistic oral infections. It's akin to leaving your front door wide open in a neighborhood known for petty theft. Your mouth, unfortunately, becomes a welcoming haven for harmful bacteria and fungi. Regular dental checkups, diligent oral hygiene, and an overall immune health boost are your best defense. Take Mike, for instance. At 60 years old, Mike was frequently afflicted by oral thrush. However, once he started managing his insulin resistance and stepped up his oral care routine, he saw an 80% reduction in infections over a 6-month period. On the other hand, delayed healing is another hidden hazard of insulin resistance. Picture this: your oral tissues are akin to a construction site, and insulin resistance is like an unexpected delay in the delivery of building materials. It slows down the repair and healing process, making every dental procedure or injury a prolonged ordeal. This is where proper nutrition for wound healing, blood sugar control, and avoiding irritants like smoking become paramount. Let's take Emma as an example. At 41, Emma's healing process after a tooth extraction was painfully slow, But when she improved her diet, controlled her blood sugar, and quit smoking, her recovery time improved noticeably. Both oral infections and delayed healing underscore the far-reaching effects of insulin resistance on our dental health. But remember, insulin resistance is not a life sentence. With the right strategies, you can manage its effects and maintain a healthy smile. By addressing your insulin resistance and maintaining good oral hygiene, you can significantly reduce the risk of infections and improve your recovery from dental procedures and injuries. Remember, managing dental health in the context of insulin resistance requires a comprehensive approach. By addressing both your oral hygiene and metabolic health, you're not just protecting your smile, you're supporting your overall well-being. Thank you for joining us in the Victory Education Lounge. Don't forget to like, subscribe, and share your thoughts in the comments. Your experiences could help others on their journey to better oral and metabolic health. Disclaimer: the information provided in this video is for educational and entertainment purposes only. It is not intended as medical or dental advice. Any health-related decisions, especially those related to dental care and metabolic health, should be discussed with a licensed physician or qualified healthcare professional.